At Senior Health Fixed, we're committed to bringing life-saving tips right to your ears, and today's might just change how you sleep forever. Because if you're over 60 and still sleeping in this one common position, you could be unknowingly putting serious strain on your heart. Not tomorrow, not next year, right now. Now, let's be honest. When was the last time you thought about the way you sleep? Maybe you just crawl into bed, get cozy, and drift off. No second thought. But what if I told you that the way you position your body while sleeping could be increasing your blood pressure, reducing your oxygen intake, and putting silent pressure on your heart night after night? This isn't scare talk. It's a wake-up call. Especially for seniors whose bodies are more sensitive to circulation, respiratory function, and joint health. What once felt fine in your 30s or 40s could now be causing subtle damage while you sleep, and all without a single symptom in the beginning. You may have heard that sleep is the body's time to heal. That's true, but healing can happen efficiently if your body is working against itself because of a poor sleep position. Imagine spending 7 or 8 hours every night in a pose that slightly compresses your chest, shifts your spine out of alignment, and restricts deep breathing. Multiply that over years, and you start to see why many cardiologists and sleep specialists are sounding the alarm. So what's the position we're talking about? Sleeping on your right side. Wait, really? You might be surprised. After all, sleeping on your side is often recommended to prevent snoring and improve digestion. But the side you choose matters more than most people realize, especially when it comes to your cardiovascular health. According to several studies, right side sleeping may compress the vena cava. That's the large vein that returns blood to your heart. This compression can reduce circulation, subtly increase your heart rate, and cause the heart to work just a little harder than it needs to. Over time, this strain can add up, especially in seniors who may already be managing high blood pressure, heart disease, or reduced circulation. But that's just the beginning. Doctors have observed that left side sleeping may actually benefit heart function, especially in older adults. When you sleep on your left side, gravity helps blood flow more freely through your heart. It also reduces pressure on the heart muscle and improves oxygen delivery throughout the body. This is particularly important if you suffer from conditions like atrial fibrillation, hypertension, or sleep apnea, all of which are more common after age 60. Now you might be wondering, if left side sleeping is better, why is right side sleeping so common? The answer is simple: comfort and habit. Many people naturally gravitate to their right side because it feels familiar. Some even switch in their sleep without realizing it. But just because it feels comfortable doesn't mean it's good for your long-term health. Think of it like this: drinking soda might feel refreshing, but we all know too much of it takes a toll on your body. Right side sleeping is similar. It may not hurt you instantly, but that nightly position can slowly chip away at your heart health. And by the time symptoms appear, like shortness of breath, fatigue, or an irregular heartbeat, it may already be too late to reverse the effects entirely. Now, let's dive a little deeper. What actually happens inside your body when you sleep on your right side? Picture your heart. It's slightly tilted on the left side of your chest. When you lie on your right side, gravity shifts your body weight toward the right, and in doing so, pulls the heart toward the rib cage. This subtle pressure can slightly alter electrical conduction in the heart. Yes, your heartbeat, especially if you already have arrhythmias or a pacemaker. It's not just theoretical. In a study published in the Journal of Clinical Sleep Medicine, researchers found that patients with heart failure were far less likely to sleep on their right side. Why? Because it actually made them feel worse. Some even experienced palpitations or breathlessness. That's how real this connection is. Your body knows even if your brain doesn't register it during sleep. And then there's the autonomic nervous system, which controls your heart rate, breathing, and blood pressure. Right side sleeping has been shown to activate the sympathetic nervous system more aggressively, the part of your body responsible for the fight or flight response. That means instead of relaxing and entering deep restorative sleep, your body stays slightly more alert, slightly more stressed, and slightly more inflamed. Over time, this reduces your sleep quality and contributes to long-term wear and tear on your cardiovascular system. Now, contrast that with sleeping on your left side. When you lie on your left, the heart sits comfortably over your ribs without being pressed or tugged. Your diaphragm has more room to expand, which means better oxygen intake. The parasympathetic nervous system, the rest and digest side of your brain, becomes more active. That means slower heart rate, deeper breaths, and better recovery overnight. It's almost like your body finally gets the green light to fully recharge. And here's the kicker: sleeping on your left side may even help prevent dangerous acid reflux. As we age, the valve between the stomach and esophagus tends to weaken, leading to nighttime heartburn, especially after eating late dinners. On the left side, the angle of your stomach actually keeps acid from creeping back up. On the right side, it does the opposite. It encourages reflux, which can disturb your sleep and increase your risk for inflammation, even esophageal damage. But let's pause for a moment. Maybe you're thinking, I've been sleeping on my right side for years. Am I already in trouble? The answer is not necessarily. The human body is incredibly adaptable. What matters most is what you do starting tonight. And that means taking small, intentional steps to shift your sleep posture in a way that supports your heart, lungs, and overall well-being. Start by training yourself to sleep on your left side. You can place a firm pillow behind your back to prevent rolling, or even invest in a body pillow to help you stay in position throughout the night. Use a pillow between your knees to align your spine, and make sure your head pillow keeps your neck in a neutral position, not too high, not too flat. It might feel odd at first. You may wake up on your right side again, and that's okay. The key is consistency. Over a few weeks, your body will begin to adjust, and left side sleeping will feel more natural, more restful, and more beneficial. And if you suffer from back pain or arthritis, you might be wondering if left side sleeping will worsen your symptoms. The truth is, it can actually help. With the right support and posture, left side sleeping reduces spinal stress and opens up your joints, especially if you use a pillow to support your legs and arms. Your back muscles relax, your joints feel less pressure, and your circulation improves from head to toe. Let's not forget something else just as important: your breathing. Seniors are more prone to sleep apnea, a dangerous condition where breathing repeatedly stops and starts during sleep. Sleeping on your back or your right side can make this worse. Left side sleeping can actually reduce the frequency and severity of apnea episodes by preventing the tongue and soft tissues in your throat from collapsing inward. So what you have here isn't just a change in sleeping position. It's a simple, completely free shift that could support your heart, help your lungs, reduce reflux, improve sleep quality, ease joint pressure, and even lower your blood pressure, all while you sleep. At Senior Health Fixed, our mission isn't to overwhelm you with warnings. It's to empower you with action. And what's more empowering than realizing that the way you lie down tonight could help protect your heart tomorrow? Let's talk real life results. When seniors begin switching from right side to left side sleeping, the feedback is often subtle but meaningful. I don't wake up as groggy. My breathing feels easier. That tightness in my chest in the morning, gone. These aren't just pleasant side effects, they're signals from your body that it's working better, recovering faster, and operating with less internal strain. And here's something most people don't think about. The longer you sleep, the more important your position becomes. If you're someone who's in bed for 8 to 9 hours, which is common for seniors, those hours spent in the wrong position compound the problem. That's why early action matters. Now, some people ask, if left side sleeping is so good, should I avoid every other position? Not quite. Let's break it down. Sleeping might seem neutral, but it's risky if you have sleep apnea, snore, or have acid reflux. Gravity pulls the tongue and soft palate backward, narrowing your airway. It can also increase lower back pain unless you use proper leg support. Stomach sleeping is the worst for spinal alignment. It twists your neck, strains your lower back, and offers no real benefit to your heart or lungs. Most doctors strongly discourage this posture, especially for seniors. Right side sleeping, as we've covered, can be comfortable, but it adds more strain than necessary on your heart, especially if you already deal with high blood pressure or circulation issues. That's why left side sleeping isn't just a preference, it's often a prescription-free tool for healthier aging. Some cardiologists even go as far as recommending left side sleeping to patients with congestive heart failure. In fact, in certain sleep studies, people were shown to have lower nighttime blood pressure when sleeping on their left side. That's not just good for your heart, it's potentially life-extending. But what if you can't stay on your left side all night? That's okay. Progress matters more than perfection. Start with just 20 to 30 minutes on your left side before rolling over. Use a firm back wedge, a U-shaped body pillow, or even a rolled towel to help position yourself. With repetition, your body will adapt. Think of it like physical therapy for your sleep habits. The more consistent you are, the more automatic it becomes. And if you're a caregiver, take note. Seniors with cognitive challenges or limited mobility may not be able to adjust their position easily. In those cases, gentle support tools like side wedges or pressure relief mattresses can be incredibly helpful. It's a small change that offers a huge return on investment for their safety, comfort, and long-term heart health. There's also a psychological benefit to consider. Seniors who sleep better feel less anxious, more mentally clear, and better able to manage the day. That's no coincidence. Deep sleep reduces cortisol, your stress hormone, and increases melatonin, your body's natural rest chemical. Sleeping on your left side helps facilitate deeper, less interrupted sleep, which boosts emotional resilience and sharpens memory, something we all value as we age. And here's something else to keep in mind. The older you get, the more important it becomes to reduce any unnecessary stress on your internal organs. Your body has been working hard for 60, 70, even 80 years. It deserves the kind of support that makes its job easier, not harder. Choosing a better sleep position is like giving your body the right tools to repair itself overnight. If you've had heart surgery, a pacemaker, or struggle with irregular rhythms, be sure to talk to your doctor about sleep positioning. While left side sleeping is generally beneficial, there may be rare exceptions, especially in the early recovery stages after surgery. But for the vast majority of seniors, this small shift is safe, effective, and completely within your control. Think of this as a nightly investment in your longevity. You're not just sleeping, you're protecting your heart, improving circulation, reducing pressure on your organs, and setting yourself up for better mornings. And all you had to do was roll over. At Senior Health Fixed, we believe that the simplest changes often bring the most powerful results. And tonight, when you lay your head on that pillow, you have the chance to make one of those changes. No medication, no surgeries. Just a quiet, thoughtful decision to turn on your side and support your heart the way it's been supporting you your whole life. Think about how many nights you've slept in a position that wasn't helping you heal. Not because you did anything wrong, but because no one told you how much it mattered. But now, you know. And knowledge is where real health begins. This isn't just about comfort. It's about protection. It's about waking up tomorrow with a little more energy, a steadier heartbeat, a clearer mind, and a lighter chest. It's about choosing a position that helps your lungs breathe deeper, your heart pump easier, your spine rest straighter, and your brain sleep deeper. The truth is, aging doesn't have to mean decline. It can mean wisdom, intention, and smarter choices. Choices that give you more control over how you feel, how you sleep, and how you live. And this one change, turning to your left side at night, it may feel small, but it's a quiet revolution in how you care for yourself. You've cared for others. You've worked hard, raised families, supported communities. Now it's time to care for your own body with the same dedication. Because your body is still working for you. Every heartbeat, every breath, every night. Isn't it time you return the favor? Here's what to do next. Tonight, before bed, take 5 minutes to prepare your sleep environment. Add a pillow behind your back to keep you from rolling. Use a supportive head pillow to keep your neck aligned. Place another between your knees to ease your lower back. Then gently lie on your left side. Breathe in and out. Let gravity do the healing. Let your heart rest without resistance. Let your body recharge in peace. It won't always be perfect. You may shift in your sleep. You may wake up on the other side. That's okay. This isn't about perfection, it's about progress. And every night you intentionally choose your heart side, your body will remember and respond. We started this journey by asking you to stop sleeping in a way that's quietly hurting your heart. Now we're asking you to start sleeping in a way that supports it, one night at a time. If you've made it this far in the video, you're already different. Most people scroll past information like this, but not you. You're still here. You care, you're committed, and you're taking control of your health in ways many never do. That's not just commendable, it's powerful. So share this message with someone you love, a partner, a parent, a friend, because heart health isn't just an individual issue, it's a family one. Let's make this the generation that sleeps smarter, lives longer, and wakes up stronger. And don't forget, here at Senior Health Fixed, we'll keep bringing you science-backed, practical tips to help you live your best years with clarity, confidence, and care. Because your health isn't behind you, it's still yours to protect. So tonight, as you drift off to sleep on your left side, smile. You've already done something good for your heart, and it's going to thank you. Until next time, stay safe, stay supported, and stay tuned. Your health journey continues with us and with you.